Welcome to another edition of Conversations with CASA. My name is Vicki Spriggs and I'm CEO of Texas CASA. My guest today is Kate Murphy, who is the Senior Child Welfare Policy Associate at Texas CASA for Children. Thank you for joining us, Kate.
I'm happy to be here and impressed you got my title out in one fell swoop.
I was just going to say, I'd like to see the card. Your card must be this big.
Yeah.
Can you tell for our viewers who aren't familiar with Texas CASA for Children, can you tell us a little bit about Texas CASA?
Sure. Texas CASA for Children is a nonprofit based here in Austin that does statewide policy advocacy on multiple children's issues. So I lead our work on child abuse and neglect prevention and on foster care, but we also cover early childhood, we cover child and maternal health, children's mental health, juvenile justice. We have a little team that tries to hit all of those issues.
Seems like it's a lot of issues too. You stay busy.
We sure do.
Yeah. So today we're going to talk about substance abuse and the impact in the child care system. So what is it that you think most people don't understand about substance abuse?
I think one of the things that people really don't understand about substance use is that it's a disease, right? I think that there's a lot of stigma around substance use and a lot of negative thoughts around people with substance use disorders. And I think it can be a really hard thing for people to wrap their minds around and comprehend. And it's really important for people to learn about substance use, how it affects individuals and how it affects families, because it is such a huge driver of children into the child welfare system in Texas.
Absolutely. And I mean, it's such a big issue that even when I was asking the question, I said substance abuse. And we're really talking about substance use. And we're talking about, as you said, the disease of substance use, which can be, if someone is really involved with the use, very detrimental.
Yes.
So what are some of the stigmas that people have when working with a parent who has a substance use disorder?
I think a lot of people don't understand that at a certain point, it's not a choice anymore. It's a pattern of behaviors. There are actual changes that happen in the individual's brain that affect everything, affect how they respond to all kinds of different things in their lives. And there's this drive that just doesn't operate the way that people who don't have a substance use disorder's brain works. It just changes how you see things, how you do things, and how the actual neurons in your brain fire, and that affects all of the decisions you make. So I think, people often see people with substance use disorders or with substance misuse, and I think one of the things with substance misuse, which can create problems and can even create safety problems. I think there's an assumption that if there's substance misuse, it's a substance use disorder. Not every instance of substance use, even substance use that causes danger, is a substance use disorder. And then when you have a substance use disorder, there are actual changes to your brain that I think people just don't know how to respond to that or what to think about that. I think a lot of people still see it as people just making bad choices, and it's a lot more complex than that.
Mm-hmm. It's you have control over this, and you made this choice, and so whatever happens to you, right? Yeah. You're familiar with CASA and the role of CASA volunteers, right?
Yes.
So what could a CASA volunteer do if that volunteer is working with a child whose parents have a substance use disorder?
I think one of the best things for CASA volunteers to do to start out is to listen to the parent, to listen to where they're at, and to try to understand what the parent is going to need if the parent is going to get better and be able to be an effective parent. I think most parents with substance use disorders want to get better. Most of them want to be parents to their child. Most of them want to be good parents to their child, but they maybe don't have the tools in their toolkit to get there. And they maybe are going to need a lot of intensive recovery supports and recovery services and treatment services to get there. So I think one is listening to the parent and understanding where they are. And, I think CASA actually has been a great leader in partnering with families and partnering with parents through collaborative family engagement and some of the other work that you're doing. But I think they can be a leader in every courtroom, whether that program's there or not, by listening to parents and understanding the treatment plan for the parent and what the course of treatment looks like, and how things like relapse fit in, and what is working and what progress looks like, because I think that's something that is not well understood.
Mm-hmm. There's such a societal bias against people who use substances anyway,
Mm-hmm.
that when you factor in the whole child welfare component, then you get a double negative whammy.
Yeah, it's easy to start looking at the parent as the bad guy, rather than someone who has a disease, who needs treatment, who needs help.
Mm-hmm. And I think that's where that listening helps prevent the CASA volunteer from further stigmatizing the parent.
Yes.
Yeah, being able to listen and respond to what they hear. What are some of the gaps you see in the services that currently exist? Well, let me stop. There's a huge gap in the services that currently exist. What do you see? Is there a bright light on the horizon? As you look at this topic, what does the future hold?
I think there are some exciting opportunities. One of those opportunities is the Family First Prevention Services Act. That is going to create an opportunity to draw down more funding for substance use services that are evidence-based in the state of Texas. It's going to, another piece of the puzzle that Family First allows for is that if a child is in care, they can be placed with their parent in family-based residential substance use treatment, and the federal government will continue to pay for that. Family First is kind of a complicated piece of federal legislation, but I think it really presents some very cool and very unique opportunities to draw down funding to expand resources for families who are affected by substance use disorders and involved with the child welfare system. So that's a really exciting opportunity. I think there's some other work that we could do around plans of safe care, which is another piece of federal law. States are required to really take a look when we know that there's an infant that is born who has been exposed to substances, to really take a hard look at what we need to do to wrap around that child and the mom to make sure that they're both getting the care that they need and to try to keep them safely together. I think I know that there's some work being done at the department around plans of safe care and how we can improve those. And so I think those two things present some really cool opportunities for us to move forward in Texas. I think there's been some momentum around substance use in Texas and a greater understanding among policymakers that substance use is a disease. It is a real challenge. We've had the opioid crisis ongoing, which hasn't been the biggest issue in Texas, but has been in the news a lot and has got people thinking about substance use a lot. So I think there's kind of a new understanding of what effective treatment looks like, what kind of supports people need, what we could do with more funding. So I think there are some very exciting opportunities to start filling those gaps in services that exist.
Super. And I know that research shows that mothers who have a substance use disorder, who are able to be kept with their child, are more likely to move forward.
Yes.
In their care.
Yeah.
And that's a bright light on the horizon. The more we can support the mother and child being together, the more likely we are to have a healthy reunification and unification, actually, because we don't separate them.
Yes.
To keep that family together and create positive outcomes for the child.
Yes, well, and on that same vein, what we know from science now, for a child with neonatal abstinence syndrome, a lot of non-medical interventions that have to do with mother-child bonding are actually what the child needs to heal most effectively. So things like skin-to-skin contact, breastfeeding, and baby being connected to mom very directly is going to help that child stop experiencing withdrawal symptoms faster, more effectively, and with less negative long-term consequences than with traditional medical interventions for withdrawal symptoms.
Wow.
Yeah.
Wow. Well, the Family First Act creates a wonderful opportunity for Texas, because our challenge, again, we talk about gaps in services. We don't have enough substance abuse or use providers in the state that are, and the second level of that challenge, though, is the evidence-based, right? So we have the challenge of getting enough services in place and getting them across the state. And so anything we can do to work to support within the existing structure, the parent and child would be an effort not wasted.
Right.
Right.
Right. And I think, there are a few opportunities for that. I think Family First is exciting, particularly as it relates to family-based residential substance use treatment. But also, if we can figure out ways to support people in outpatient treatment, which is the most appropriate and often most effective if it's really followed by the parent. There's a lot more outpatient services available in Texas than there are inpatient services. There are a lot more inpatient services generally than there are family-based residential treatment services where the child gets to stay with the parent in treatment. But outpatient is another opportunity for the child potentially to stay connected to the parent during treatment, for the parent to keep their job during treatment. And it can be a really important piece of the puzzle too, that would be probably easier to expand more quickly than some of the inpatient possibilities.
Absolutely. And even if the connection with the mom is not, the child may not be at home, but if they're with the aunt or the uncle or the cousin somewhere nearby, then you're still able to maintain that bond and keep that connection.
Exactly.
Yeah. Any last thoughts for our viewers?
I think I'm just very excited that CASA is paying attention to this, that y'all have such a wonderful, strong network of volunteers who are really working to support children, really working to support their families. And I think when we're looking at things like parental substance use or other mental illnesses, but substance use, since that's what we're here to talk about today, this is really one of those areas where if we can wrap around that whole family, if we can really support that parent in their treatment and in that recovery process and set them up for success, it's not just good for the parent and their recovery, it's good for the child too. And so it's just such a wonderful area to get to really support the entire family unit. And I think CASA can be such an important piece of that as an advocate for the child, reminding the court that that this is really an opportunity to support the family and that is going to be best for the child too.
Absolutely. Absolutely. Kate, thank you for being with us today. And Kate's conversation leads me to this shirt. This is a Texas CASA shirt, which is more we, less me. And that's what we're talking about as it relates to this topic as well. Because if we put our own thoughts, our own biases aside as it relates to someone who has a substance use disorder and really focus on what is in the best interest of the child, we can change the trajectory of Texas. So thank you for being a viewer today. I look forward to seeing you next time.